Hello and welcome to NHIS in a Week, where we give you the happenings and highlights of the authority and the scheme. My name is Shanice Palm. Now to our headlines. NHI Chief Executive pledges transparency in his operations. NHI to sustain free dialysis services. And Eastern Region tops 2024 NHIS membership performance. Now to our first story. The new Chief Executive of the National Health Insurance Authority, Dr. Victor Saribampo, has pledged to lead with transparency, accountability and fairness in managing the National Health Insurance Scheme. Addressing NHIS staff and stakeholders during his tour of the Northern Region, he assured them of his commitment to restoring public confidence in the scheme.
NHIS Chief Executive Dr. Bampo, together with his Deputy in charge of operations, Dr. Senanu Jokoto, and other senior officials, met with NHIS staff in Tamale, where he expressed deep concern over reports of financial mismanagement and extortion in the NHIS.
NHIS sometimes gets a bad rap. People talk about all sorts of things. Extortion, people taking money. They don't see the good sides sometimes, they see the bad sides and they talk about it. Be that as it may, the first thing I want to help us to do is to tighten those internal controls that would ensure that there are no opportunities for there to be fraud, to be misappropriation, and all those associated things. It is important for us to be as clean as possible and to do our work in a way that will not attract opprobrium and some of the negative publicity.
He urged staff to uphold ethical standards and work towards the government's vision of free primary health care and the Mahama Cares initiative, which supports patients with chronic renal disease.
The third and final thing is the President's very big vision, Mahama Cares, free primary health care. It is imperative that we move forward on that. We really need to work hard on that. We need to deliver. Dr. Kinkong is a special senior director and liaison to the Ministry of Health. He will be spearheading that work. But each one of you has a role to play in that. So we are looking to you to help us to achieve that.
As part of his reform agenda, the Chief Executive announced plans to conduct a human resource audit to address staff concerns and improve working conditions. His deputy also commended the staff for their hard work and encouraged them to strive even better in the years to come.
We have a common vision. We set out a scheme in 2004, and we wanted to make it sustainable, to make it progressive, and also to ensure that it is equitable. So whichever part you are in this country, you should be able to benefit from the national health insurance. I am sure that we are all committed to it. The President has given all of us, being spearheaded by Dr. Victor Bampo, a mandate, and I know that, God willing, by the time we celebrate our 25th anniversary in the year 2028, we would have gone beyond our expectation.
The acting Northern Regional Director, Abdullahi Al-Hassan Nabili, commended Dr. Bampo for his proactive leadership and pledged the region's full support in achieving widespread NHIS coverage.
Dr. Victor Saribampo continued his regional tour, visiting NHI offices and engaging with stakeholders in the Northern and Upper East regions.
As part of his tour, Dr. Bampo paid a courtesy visit to the Northern Regional Minister, Mr. Ali Adolf John. He emphasized the need for strong collaboration between the NHIA and the Regional Coordinating Council to achieve universal health coverage. His visit also included an inspection of a piece of land that was originally earmarked for a new modern office complex to house the Tamale Claims Processing Center, aimed at improving service delivery and efficiency. At the Upper East Regional Hospital, hospital management briefed him on the challenges, including delayed reimbursements and concerns over the NHIS free dialysis services.
Another teaching one is, which is more present, is the dialysis. Whether dialysis is free, dialysis is not free. We want some strong clarity on this matter to help in how we approach it and operationalize it.
In response, Dr. Bampo reaffirmed NHIA's commitments to addressing these issues.
We need to issue some kind of statement very clearly that the dialysis is ongoing until Mahama Care takes over in that shape or form. And then probably DOC would reconvene that dialysis group and then put in place the modalities to ensure that there is no break. And so we will.
NHIS staff in the Northern and Upper East regions welcomed their new chief executive and his deputy operations with open arms, showing their support for his leadership.
At separate staff derbers in Tamale and Bolgatanga, NHIA staff warmly received Dr. Bampo, presenting him with a traditional smock, a gesture of respect and acceptance. For many staff members, the visit was a morale booster, renewing their confidence in NHIA's leadership and the future of the scheme.
In a bid to sustain free dialysis treatment under the NHIS, the Deputy Chief Executive, Dr. Senanu Kwesi Jokoto, has assured patients of continued support.
Speaking at the Tamale Teaching Hospital's annual performance review, Dr. Jokoto emphasized NHIA's commitment to ensuring uninterrupted access to dialysis treatment for renal patients.
Whilst listening to the CEO, we had some uncertainty with the dialysis service that is actually running currently. The good news is that the stakeholders in health, including the National Health Authority, will do everything possible to create a sustainable and progressive atmosphere for the delivery of efficient services to all our clients who are on dialysis. So I am certain that there will be no interruption to the services that are being rendered by accredited facilities.
He also highlighted the critical role of the Mahama Cares initiative in supporting patients with chronic illnesses, including hypertension, diabetes, and kidney failure.
Yesterday, the Ghana Medical Care Trust Fund was launched, and it's going to look at the comprehensive approach towards dealing with some of these chronic ailments. So those who are hypertensive, diabetics, those who need interventions like dialysis, definitely we need a visionary policy that will be able to support some of them or all of them against some of these debilitating financial consequences of the ailments that they have. We are certain that within the next couple of years, it should be adequately dealt with. Not only that, we are also going to support the free primary health care to ensure that as much as possible, we don't have people getting into end stage of some of these diseases, which are very expensive to treat.
Hospital management welcomed NHI's assurances and emphasized the need for continuous collaboration to ensure the smooth operation of the free dialysis program.
The NHIS Corporate Affairs team has taken its public education campaign to Achimota Hospital and engaged patients on the benefits of the NHIS.
Expectant mothers at the antenatal unit were educated on the NHIS free maternal care package, while outpatients were introduced to digital services, including the My NHIS app and the renewal short code *929#. Hospital management praised NHIA's sensitization efforts, emphasizing the need for more outreach programs to expand public awareness and accessibility to NHIS services.
The Eastern region has been recognized as the top-performing region in NHI's active membership registration, exceeding its annual targets by more than 99%.
At the NHIS 2024 Annual Performance Review in Koforidua, officials announced that the Eastern region had successfully registered over 2 million active members. The achievement was attributed to aggressive outreach initiatives, mobile renewal options, and strong partnerships with traditional leaders and social welfare agencies. Regional Director Eugene Opoku Efrifa commended the dedication of NHI staff and called for sustained efforts to maintain their top position.
And finally, NHIS staff celebrated Ghana's rich cultural diversity with a vibrant Rep Your Culture Day.
As part of celebrating Ghana Month, the Corporate Affairs Directorate spearheaded the involvement of staff to dress in colorful traditional attire representing their culture and the nation's diverse heritage. The event fostered unity and a sense of belonging among staff, reinforcing NHIA's commitment to cultural appreciation in the workplace.
Question of the day.
Afi etwe mu no na me wo health insurance card no bi nanso manfa nkwa yaresabia esanse yare bia ambome yesi afifufuro yi etwa se me sentue bibi kakra ansa na metimi de card no akwa yaresabia na
Anio emfa ho sa wo de card ne ko hospital na wan fanko afie bia no ese wotua kakra me friend premium na ma card no etimi ye de mu hyane nso wona anya mfie edioson edeko anyone out to so Emma Senate Nedia, one cabo. Aya Kai so be dial *929#. Now after option 2, what did she say?
Give me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be Pedro board damn.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in me. Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Don't forget to dial *929# and follow the prompt to keep your membership active. That's all that we have for you in this week's edition of NHIS in a Week. For more information, do visit our website www.nhis.gov.gh or visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.